This is Health and Wellness Part 3. So when we're looking at implementation for health promotion, I wanted to look at some examples, and we're going to go through systems. So the first one is respiratory system. When we're trying to promote health of the respiratory system, we're trying to promote expansion of the chest and lungs and preventing the stasis of pulmonary secretions. In other words, trying to get them to cough them out. So we're maintaining a patent airway. Changing the position of the patient at least every 2 hours allows the dependent lung regions to re-expand, maintains the elastic recoil property of the lungs and alveoli, and clears the dependent lung regions of pulmonary secretions. You can also promote lung expansion through regular deep breathing exercises, the use of an incentive spirometer, and forceful coughing. We want to make sure for the metabolic system that we have adequate nutrition and fluids to help the body fill its purpose. And again, changing patient's position reduces stagnation of all secretions, and patients should be adequately hydrated to keep their cilia intact. Without adequate hydration, all secretions become thicker, tenacious, and difficult to move around the body. When it comes to nutrition, we need that to prevent tissue breakdown for a patient of any age who is immobile. And we need it for patients who are mobile to keep up their energy. So the plan of care must be designed to incorporate enough carbohydrates, proteins, and fats to combat any effects of immobility and give patient energy. Nutritional deficit results in complications such as pressure ulcers, which could be fatal for the older patient. When we look at the cardiovascular system, we know that proper positioning with anticoagulants and antiembolytic stockings also helps reduce thrombus formation. Providing appropriate patient education to patients who are on blood thinner therapy is an option. Range of motion exercises reduce the risk for contractures and also help prevent thrombi. Specific exercises that help thrombophlebitis are ankle pumps, foot circles, hip rotations, and knee flexion. These exercises are usually done each hour while awake and are aimed at preventing thrombi. They are sometimes called anti-embolytic exercises. When we look at the musculoskeletal system, we might see an immobilized or partially immobilized patient needing to exercise to prevent excessive muscle atrophy, decreased endurance, and joint contractures. The amount of activity required to prevent physical disuse syndrome is only about 2 hours in a 24-hour period. Therefore, schedule this regularly throughout the day based on individual patient needs and as well as tolerance. The best nursing intervention is establishing an individualized progressive exercise program. A progressive exercise program gradually increases the patient's physical activity to reverse deconditioning associated with immobility. Teaching is an important aspect for patients with limited mobility. We also see health promotion when it comes to skin integrity, in preventing pressure ulcers, in preventing skin cancer as well. Limiting time in the sun can help prevent skin cancer. When we look at the elimination system, urinary as well as bowel, we know that exercise and movement helps people keep their urinary and bowel tract moving, preventing kidney stones and preventing UTIs is very important as well. Lots of health promotion and patient education in those areas. We have to remember that illness is never an isolated life event. The patient and family must deal with changes resulting from illness and treatments associated with illness. Each family member and patient will react differently, and that means interventions need to be individualized. Individual behavioral and emotional reactions depend on the nature of the illness, the patient's attitude toward it, the reaction of others to it, and the variables of illness behavior. Short-term, non-life-threatening illnesses evoke few behavioral changes in the functioning of the patient or family. The impact of body image can also impact patient and family. Changes in physical appearance, and patients and families react differently to these changes. It depends on the type of change, the adaptive capacity of the family, the rate at which changes take place, and support services are available. So remembering, for example, a chemotherapy patient who has lost hair, there's a good example. It's a sudden change in physical appearance, and how do people react to that? The impact on self-concept. Remember, self-concept is the mental image of all aspects of your personality. Self-concept can change if you're no longer able to meet expectations, which can lead to tension or conflict. Family members change their interactions with the patient. People who have many roles in life, such as wage earner, decision maker, professional parent, often have a large impact of illness. When illness occurs, the role of the patient and family changes. This change can be subtle, it can be short-term, it can be drastic, it could be long-term. Illness also affects family dynamics. Family dynamics is the process by which the family functions, makes decisions, gives support to individual members, and copes with everyday changes and challenges. Because of the effects of illness, family dynamics often change. Another family member sometimes needs to assume the patient's usual roles and responsibility. This often creates tension or anxiety in the family. Remember that the nurse also has a role to provide positive reinforcement for the patient as they're trying to go on their journey of health and wellness. So encouraging the patient to make those changes, to point out their successes that they have, will help the patient become and remain successful. I'm going to move on to just a couple slides about the healthcare delivery system. It is complex and changing all the time, is less service-oriented and much more business-oriented than it used to be, and people of an older age will tell you about that. It can cause tension between the caring part of healthcare and the business aspect. Nurses need to lead the way in change while valuing and providing evidence-based, compassionate care, continuing in the role as patient advocate, at the same time meeting the challenges of new roles and new responsibilities. The healthcare industry is moving toward practices that emphasize managing health rather than illness, because in the long term, health promotion reduces healthcare costs. A wellness perspective focuses on the health of population and community rather than just individual. So we have these integrated delivery networks, which is a set of providers and services organized to deliver coordinated continuum of care to a population of patients in a specific market or geographic area. This reduces duplication of services, coordinates care across the settings, and ensures patients receive care in the most appropriate setting. So an example of this would be Mid-Michigan Health. With Mid-Michigan Health and with many health centers, you can make your way through to be diagnosed, to get your treatment, to have your follow-up, and stay within the same healthcare system. The healthcare services pyramid is a model of improving healthcare. Population-based healthcare services provide the basis for preventive services. Achievements in the lower tiers of the pyramid contribute to the improvement of healthcare delivered at higher levels. An emphasis on wellness and health of populations and the environment enhances quality of life. Preventive and primary care that is available at a physician or healthcare provider's office, school, occupational health clinic, or nursing centers. Healthcare providers at the primary level of healthcare build interventions that lead to improved health outcomes for an entire population. Looking at different levels of service and nursing roles and changes with goals of care. If we look at secondary care and tertiary care, which is also called acute care, they are expensive, particularly if patients wait to seek health care until after symptoms have developed. Secondary and tertiary care are available in hospitals, emergency departments, urgent care centers, critical care, inpatient medical surgical units. Discharge planning with coordination of services begins the moment a patient is admitted to a healthcare facility. Hospitalization involves relatively short stays with the purpose of stabilizing patients before transfer to outpatient treatment centers. When we look at different levels of care, that can help us determine what the goal of care is going to be. So if we look at restorative care, which is basically home care or rehabilitation, they use multiple therapies such as physical, psychological, occupational, speech and language, and social services to help restore a person to the fullest physical, mental, social, vocational, and economic usefulness as possible. The intensity of care has increased in restorative care settings because patients leave hospitals much earlier than they used to. Patients and families are more likely to follow treatment plans and achieve optimal functioning when they are involved in restorative care. Home care is the provision of medically related professional and paraprofessional services and equipment to patients and families in their homes. Services provided include health maintenance, education, illness prevention, diagnosis and treatment of disease, palliation, and rehabilitation. An extended care facility, which could include intermediate care and skilled nursing, long-term care, and assisted living facilities. Continuing care could be looked at as a variety of different holistic services provided over a prolonged period to people who are disabled, people who were never functionally independent, or people who suffer a terminal disease. Continuing care is available within institutional settings, like a nursing home, within communities, like a group home, or in their own home. Residents receive a planned, systematic, and interdisciplinary approach to care to help them reach and maintain their highest level of function. Completing the resident assessment instrument on all residents is required by the state, as well as the minimum data set is also required by the state. Assisted living is one of the fastest growing industries in the United States. It does create a long-term care setting with a homier environment, but also gives the patient some more autonomy. Assisted living facilities do not directly provide nursing care services, although a home care nurse is able to visit a patient in an assisted living facility. Respite care is a service that provides short-term relief or time off for people providing home care to an ill, disabled, or frail adult. It may take the form of adult daycare, trained volunteers who stay in the home, or temporary stay in a nursing center. Hospice is a system. The focus of hospice care is palliative care, not curative treatment. If you decide to be a hospice nurse, you will work in an institutional and/or community settings or a patient's home.